Well, welcome back, everybody. We're talking health in the hills once again with Pike County Health Department. I have Tammy Riley with me. I have Jill Fraley again. And no, I didn't. I'm sorry. Who did I call you?
Jill.
Whoever, whatever. You over there. That's her. I also have another special guest with us today. And no, I didn't do anything goofy to get me arrested. I don't have the cuffs on. We have a special guest today. His name is Sergeant Kevin Belcher from Pike County Sheriff's Office. Kevin Belcher is former KSP or KVE, and he's trained in drug recognition, and he was deemed a specialist. He's got all kind of accolades. I'll let him introduce himself. But we're here to talk today about what's sweeping the state of Kentucky. We're finding out that this new drug that's out there that is worse than fentanyl is rearing its ugly head, and there's some opportunities available. We want to talk about that. We're going to talk about how the health department is trying to combat that. We're going to talk about how law enforcement recognizes and what they're looking for. And also, to the general public, if you know something or see something, you've got to say something. It's vitally important because lives are at stake here. We talked about a lot of different things off camera. So, Kevin, welcome. Ladies, welcome. Tammy, welcome to back to the program.
Thanks.
So we're here. Kevin, give us a quick rundown of who you are, what you do, and why you're here.
My name's Kevin Belcher. I'm a sergeant with the Pike County Sheriff's Office. I've been there for the last 11 years, and prior to that, I worked with Kentucky Vehicle Enforcement and Kentucky State Police. Retired from there in 2013, and my primarily my job was working in drug and criminal interdiction, drug enforcement. I worked on some interdiction teams and primarily focused on illicit drugs, prescription drugs.
Right.
And
you've had a lot of success with that.
Yes, we have.
And you've brought that training that you got from the state, which is a pretty high training, back to Pike County. And you're working in Pike County right now, helping to mitigate and trying to recognize and teaching not only the deputies that you're working with, but also other law enforcement officers about what to look for and how to find out what things are happening. Would that be a fair statement?
Yes, sir.
Good. Tammy, welcome back here. And Laura, welcome back again. So, let's start. Tammy, where are we with this new drug? Cyclorphene?
Cyclorphene.
Sounds like something you put in your pool.
It does. But it's not something that we want to be, taking lightly. Very serious. I mean, to our knowledge, we've not seen it. It's not in Pike County yet. I know. But the Kentucky Office of Homeland Security sent out an alert that cyclorphene had been detected in central Kentucky. So that got my attention. And along with that alert was the notification that there had been 19 deaths in what I assume is a short amount of time in eastern Tennessee. So it's around us at this point. And Laura with the harm reduction team and Sergeant Belcher can both confirm that typically when we see a new drug or trends around us, it makes its way to Pike County eventually.
Sure.
So we don't want to wait until, Laura's team in the harm reduction program or Sergeant Belcher and his work and, the other law enforcement out in the community are noticing that we're having an
outbreak,
sure. Increase in fatalities. We don't want to, in 2021, we peaked for overdose fatalities when you look back over like the last 10 years, and there were a little over 50 overdose fatalities. Right. Those were documented. There were likely more in 1 year. So that's 50 plus souls that were Pike County.
Families that were
and think of 50 some plus families.
That's that we know about.
Sure. And it wasn't much better the year after. Now we are starting to see a decline, and Sergeant Belcher and Laura and I were talking about, the direct correlation between Narcan distribution and that. But we don't want to see those numbers go back.
Right, to increase and keep going. So we want to be ahead of the curve on that. So Laura, tell me what your team is doing right now to prepare for what I hate to be a fatalist, but what we think could be the inevitable of this drug that's gonna reach Pike County. Will Narcan and education help thwart this? I mean, what are we here I go speaking French. What are we, I mean, you doing to, and the health department at your at the harm reduction part, what are you all doing to prevent or mitigate or recognize?
Well, it really has to start with the education, especially right now. We don't really have the testing efforts in our county to test to see if it is here. I do suspect that it will come. So, right now, we're just pushing out education as we learn. When it comes to harm reduction and the way that we are able to provide that public education, it's important to understand the past trends. When we look at the past 30 years, we've had three distinct waves of opioid overdose trends. And the first one was prescription medication. And then when that became a little bit more regulated and they weren't able to access that, they went to heroin. And right now we're in a synthetic opioid wave. And unfortunately, that means that unlike the other two ways where we could tell you exactly what it is, exactly where it's coming from, exactly what to look out for, exactly how to respond, the synthetic opioids are coming out at such a rapid rate, and there's so many of them, and nothing is pure anymore that it's really hard to stay ahead of that. And sometimes we have to say, it's so dangerous right now. We don't really know the full scale of it. We're learning as we go, and it's really hard to inform the public whenever we're at a point right now in the crisis in the way that
I mean,
it is.
bottom line, if you're purchasing something off the street that's illicit, it is likely,
Yes.
contaminated and with something,
And many different ones.
Fentanyl's bad enough.
Yeah.
The cyclophane, we're being told, is 10 times stronger than fentanyl, right, Sergeant Belcher?
Yeah. So,
Correct.
so Kevin, talk to us about the danger of this new drug. I was told that a pinhead of fentanyl can kill a whole town. How dangerous is this new drug?
Oh, it's very dangerous. It's you take into consideration or you compare fentanyl and carfentanil to it, 10, 15 times more powerful than that. And the problem is a lot of, especially since it's so new and it's making its way here, a lot of people don't realize what they're getting when they go out and buy an illicit drug.
Sure.
They don't understand the danger. Testing isn't up to par in some areas. Some labs need to kind of catch up a little bit on that. But as far as Narcan goes, you got a lot of people don't realize how much you may need because you might have to take more than 1, 2, 3 doses of Narcan to combat this new drug.
Right. How often, I mean, you're in law enforcement, you hit the streets every day in Pike County. How often are you administering Narcan right now?
Oh, we use it every month. I don't know an exact number right now. Myself, I use it. The last time I used it was probably 2 months ago, but a lot of guys are using it more prevalent than that.
Laura, would you say we have access to OD map? And I don't know if you're seeing OD map or not, but Laura gets those notifications for suspected overdoses, like emergency responders, for example.
Sure.
If they're putting the information into the system, we get alerts, and you're getting those frequently, aren't you?
We had one today. We got an alert at noon today. We had an alert about 2 o'clock yesterday. So we do pay attention to that too. And on that map, we're able to see where it's at and really map it out so we can push more Narcan in that area and education and provide the resources they need, especially if we see a lot of overdoses in one spot.
Now, these are not fatalities, just over there. It's just sure dose reversals.
So the average person, you said something, the three of you guys just said, people don't know what they're buying off the street.
Right.
Where is this new drug? Where is this fentanyl coming from? Where are we getting this from? Do you have, I mean, does KSP or SO have any idea where the stuff is coming from?
Well, it's kind of hard to pinpoint because the way it's coming by the same way the fentanyl came into the country, as far as we can tell, and that is a lot of it comes from Southeast Asia, China. The fentanyl does, and this is taking the same route. And the cartels are their number one customer. So the cartels are getting it cheap from China. The cartels then push it across the border, and gangs in this country are buying it up and then distributing it all across the country, different places.
What type of gang activity are we seeing in Pike County that is territorial, that is happening, that where we know this drug is there? What are we seeing, that kind of gang activity?
We are primarily.
That scares the absolute hell out of me.
Yeah, it's becoming more and more common. Primarily, we're seeing gangs like the Bloods,
Right.
Crips, stuff like that, coming in from Ohio. Akron is a big area. Columbus, Cleveland, Cincinnati, Louisville. So we're seeing all that stuff's being pushed down into the mountains.
Right. Is it because are we experiencing a lot of drug use because we're vulnerable? Are we experiencing a lot of drug use because we have lack of hope? What are you guys seeing when people come to the health department and say, "I need help and I'm on drugs and here's the reason why"? What are they telling you?
I don't think that it's that we're experiencing at a higher rate. I think that a lot of the people who are actively using are more comfortable to seek help. So it may seem as though we have more, but I think it's prevalent in a lot of other areas. And I think it's just so easily accessible. And when we're talking about synthetic opioids, we're talking about the sophistication that it makes. It's not like your methamphetamine where it can be made in a basement somewhere. This is very sophisticated, and I'm not for sure. I mean, we could be targeted because there are some vulnerabilities there, but
Yeah, I will add to that. I do think that vulnerabilities come into play to a certain level. I mean, we know based on that 2015 HIV outbreak that was as a result of injected drug use activity in Indiana, and then there was one out in Texas, which triggered this CDC study, and they identified 220 communities that were considered vulnerable jurisdictions was the verbiage in the study. So they identified 220 counties that were most at risk for an HIV hepatitis C outbreak from as a consequence of injected drug use.
Sure.
IDU is called. And of those 220 communities, counties, 54 of the 220 were in Kentucky. Almost all of those 54 were in the Appalachian region.
Right.
And so we are at high risk. There is likely socioeconomic, determinants of health that come into play that impact the fact that our activities, that are high and that we're vulnerable.
Sure.
It just all it's like mental health and substance use disorder, the chicken and the egg. I mean, that they kind of go hand in hand. So we do have some social determinants of health in the entire Appalachian region that play into addiction and substance use disorder. I mean, wouldn't you agree, Sergeant
Yes.
Belcher?
Absolutely.
When we talk about the accessibility to this drug, I wouldn't know A, what it looked like, B, how it's used. I'm sure it's an injectable. And I certainly don't know the cost of this, but I'm assuming that an addict needs money to do that. So, and I would also go out on a limb and say that these addicts who are this far in trouble do not have full-time jobs. It used to be like, back in the 60s and 70s.
Surprised, Jeff. You'd be surprised, wouldn't he? Now, of course, they get to a point where they're non-functioning.
Right.
And some maybe are right out of the gate, but large C's participants, Sergeant Belcher encounters individuals in the community that are, injecting drugs that are that severe
Sure.
along the lines, and they're still functioning and working and have families. Maybe the family members don't know.
Don't know. Sure.
And that's why harm reduction is so important. It prevents, hopefully, or minimizes the spread of HIV, hepatitis C, and some of these other diseases that then spread across our community.
As the addictiveness of this new drug, I'm sure it's very strong and powerful as well. And with the people who are hooked on this that don't have jobs, I mean, would it be a fair assumption to say that we should expect to see a higher crime rate because people are going to steal crap to sell it, to go out and do that? And what do we do? I mean, if somebody's walking down the street and says, "Hey, I got a lawnmower for sale. I got a weed eater for sale," I automatically assume somebody stole it from somebody else and are trying to buy drugs. Should we alert law enforcement and say, "Hey, listen"?
I mean, it's a good question, and I'll probably have a follow-up to that
Yeah.
about harm reduction, but go ahead, Sergeant Belcher.
Well, I mean, right now we still see we still have a large influx of meth, fentanyl, heroin, and we still have issues with some prescription drugs, primarily like CNS depressants, like your Xanax, Valiums, and those. So we're still seeing problems with that, and we do see the worse shape that someone gets in, or the further along they get into their addiction cycle. It's like crime does become a factor because they have to support that habit.
Sure.
So And we do see, a lot of our criminal activity is directly related to that.
I was really interested in your response to that because I know that that's the side that you see. And what we see on our end is, and I get that perspective. But on our end, what we see and what we know studies have shown is that communities that have harm reduction programs have a reduction in crime
Oh yeah,
because the individuals that are visiting Laura and her team, they develop a rapport and they trust Laura and her team members. And so she can, I'll use the word mitigate again, mitigate some of that crime. And they're much more likely, 86% more likely. Am I using the right percentage to enter treatment if they're participating in a harm reduction program? And she's getting them resources like the basics, like food, blankets. So if they're stealing just out of desperation for some basic needs, they're less likely to do that as well. But
Sure.
I know Sergeant Belcher on his side, his perspective is a little different, and we don't see his side sometimes, and he doesn't, see
right.
ours. But
We try to build a rapport with people, but nobody likes the police. No, nobody really wants to see us.
I do.
Well, you make we talked prior to getting on camera about, how can health department reduction team work better with law enforcement so that, is it the right thing to do to take a drug addict and take him right to the big house, to the slammer and throw him in there? Yeah, it's like the old drunk tank. They'll get the DTs, they'll get sick, then the jailer and
It's
they
horrible.
want to take him to the hospital.
Yeah.
So what's the answer? How can health departments and law enforcement work together so that when we have a first time addict who overdoses and they Narcan him or her, and how do we fix that instead of taking them to jail?
I'll let you talk about Shield, but beforehand, I'll say that's kind of where we are in the process in Pike County. I mean, we've made so much progress. We've reduced overdose deaths.
Right.
Harm reduction and the work that we do is, by statute. It's in Kentucky law, and we work with law enforcement. They do their job, and we do our job, and we support each other. But then in long-term recovery and or upon arrest, let's say, and then all the way through long-term recovery, like where do we go from there? And that's kind of where we are is like, we're only open like so many hours, 5 days a week, but they're out there 24/7. So how do we better work with law enforcement in public health and in the Recovery Resource Center to aid and assist them after hours when they're dealing with someone that their real issue is addiction. Their real issue is not that they're a criminal.
Right.
Maybe criminal activity has been a byproduct of their addiction. And so we're working with UK on a grant-based project called Shield. And Laura has been directly working with them, and I have some involvement, but mostly Laura's been working with them and with local law enforcement.
Talk to us a little bit about the SHIELD program.
The SHIELD program recognizes exactly what you asked, that there needs to be a relationship between public health, specifically harm reduction, and law enforcement to tackle this. Because like I said, we're in an unprecedented wave that's continuously changing. So the way that the SHIELD program would work is that we could come in and do a training for law enforcement with another law enforcement officer, because they're going to respond more to them than us, that understands both of our purposes there and how we can help each other. Because at the end of the day, we can save law enforcement time from those reoccurring arrests. Also, we can save hospital time from responding to an overdose when their tolerance is lowered. And in the same way, law enforcement can help us build the relationship and the trust. So in return, they end up trusting both agencies even more.
Sure.
We have 24/7 answering service at the health department. So Laura and I are talking to the UK. Well, it's not UK. I'm sorry. This is another group. They actually flowed through the University of Kentucky, though, because they reached out to us. How we can use that service and so that's kind of where we are in the process. They're training us, and then Laura's going to reach out to law enforcement, and we're going to come together, and they're supposed to train us, and then we're going to look at our 24/7 answering service and how we might be able to aid law enforcement, like sure hours,
Right.
mitigate, get people into treatment, going to the correctional facility or the emergency room.
And I think, we talked earlier, it's okay and it's good to have treatment facilities, but the most important thing is what happens after that person is clean. We've got to give them hope. They've got to get a job. They've got to have transportation. They've got to be productive in society. They've got to have a purpose, because without a purpose, they go back to the old thing. And I'm sure you see this all the time. Like, you go out and arrest the same people over and over. They're clean for 3 months and they come back to where they went to, and there's no hope. There's no family. There's no support. Next thing you know, they're doing things that they shouldn't be doing. So you mentioned the addiction cycle. How bad is the cycle? Where are we in that cycle, and how bad is the cycle before that person, that addict, just hits rock bottom?
Well, I think it's getting better because of programs like Lauren and the work that
Thank
Tammy has done. Yeah, and you don't see it's not as bad as it used to be, kind of from where I see it. But a big part of that, and I mentioned it a few minutes ago, is like it's a hard it's a hard thing it's a hard cycle to break. But when somebody goes through long-term recovery, they cannot go back to the same area, hang out with the same people.
They've got to have a different purpose. So
Yeah,
so what should, right now we're seeing this stuff, what should the general public be looking for? What should we do if we see, listen, people are strangers and I hate to profile people, but if I see somebody that I don't know walking up and down my road, do I call the police? Do I question that person? Or should I just mind my own damn business? I mean, right now we don't know. So what should the general public do from your perspective? What should we look out for as far as this cycle, and as far as the influx of drugs? Should we look out for different types of behavior, different types of people that we don't know showing up in our neighborhood or running up and down our roads? I mean, what kind of talk to me a little bit about that?
that's a little tough because
That's a tough question.
yeah, it is. It's very tough because everybody's got the right to walk up and down the road.
Right.
So, but if you see anything out of the ordinary, see anything suspicious, I mean, of course, we're going to respond and contact that person, and hopefully have a good enough rapport built with the community and the public to be able to determine if that person needs help, if they're doing something criminal.
And walking down the street is not criminal, but if somebody's walking down the street flailing their arms with a shirt off or going out of their, that's a whole bit story.
Yeah, it's a little different. Yeah,
We do.
If we start seeing these cars or these people that we don't see all of a sudden, and all of a sudden it's becoming this, that, and the other thing, are we being busybodies by saying, hey, listen, I see something that just doesn't make sense to me and I want you to check it out? Or are we doing something productive for society?
yeah. Anything suspicious or out of the ordinary, I would report it. I mean, better safe than sorry, I guess.
Sergeant Belcher, please correct me if I'm wrong here, because I do not want to miscommunicate. And this is
Right.
your level, but my understanding is that the activity around drugs, like the type you were describing, Jeff, like unusual individuals on your streets or maybe trying to break into your home, that really hasn't escalated so much as that we're seeing these deadlier, stronger drugs infiltrating our community. And if we can catch it sooner and identify them sooner, prevent loss of life.
Sure.
And then that's kind of what we're concerned about. Is that a fair statement, or am I wrong? I believe
You-
law enforcement.
Oh,
about
you're,
the
oh, you're
activity.
correct. You're correct.
Okay.
So we want to keep people out of jail. We want to
We
keep
do.
people off the drugs. We want people to be productive. There's plenty of programs available. The Pike County Health Department has got many, many things.
We
If a family member, if you suspect a family member, call the health department.
Yes.
If you suspect a neighbor just acting erratically, call the health department and say, listen, I don't mean to be the tattletale, but my neighbor, I saw him jumping out the window the other day, and that's not like him or her.
Right.
So
Whatever an individual is in the recovery spectrum, and by that they may still be in an active addiction.
sure.
Or they may be fresh out of a rehabilitation, or they may be 1 year, back in their normal lives. Or it may be a family member that's struggling with a loved one who's suffering from addiction. So wherever you are, the Recovery Resource Center has resources. SROR can get individuals a bed for treatment pretty much the same day. We have Narcan, wound care kits, clean syringes to prevent harm to the individual and their family members and community. Or if you're like released from rehabilitation, don't go back into the same environment.
Sure.
All the Recovery Resource Center. We have, I mean, she has a plethora of resources to help them get a job, from clothing to help them with resume, computers, charging stations, so they can come into the recovery center where it's warm and clean, make them a hot bowl of soup,
Get an
and
ID
apply
made.
for jobs, get their ID made, um, uh, vouchers for certifications.
What we want to do is if a family member suspects something, go to the Pike County Health Department. We'll get across from the hospital, call the recovery center. Tammy, I want you to give us the phone number and I want you to give us the website.
At 606-509-5500, PikeCountyHealth.com.
So use that resource. If you suspect a family member is just not, thinking properly, or there's a problem, call the health department. Talk to Tammy, talk to Laura. And, there's a lot of information that they have that we can pass on to somebody that we have they may not be an addict. They may just be going through a mental health problem
Could be.
prior to getting into the site we just talked about.
That's right.
And you've got other resources available to you. So please go to the Pike County Health Department website, call the Pike County Health Department, and of course, emergency. You want to see this young man, 911
Yes.
is right there. He may not come by himself, but he'll send people out there.
Thank you, Sergeant Belcher, for everything you do for our community and for all first responders, law enforcement.
And you're right.
We appreciate
They don't get enough because when something happens, you've got these people. They got to get all. There I go with the hands again. They've got to get all their gloves on to make sure that they don't get infected. So
it's very important that they have Narcan, and when we ensure, and they, I know we work with the sheriff through the FR Carrier program, that they have ample Narcan at all time on themselves to protect themselves as well.
Sheriff Scott does a good job bridging relationships with
Yes.
the health
Like
department
Nancy.
and the
Yeah.
hospital. So
so
that's good. So thank you for joining us. Health in the Hills once again. Beware of this new drug, cyclorphene. And again, if you see something, don't be afraid to say something to somebody. Call. You may save a life. It may.
And you can
save
still use Narcan.
And you can
Or give me Narcan. It's a synthetic opioid.
Yeah, and it may take a couple of shots of the Narcan, but if you can save a life, it saves a life. So, ladies, thank you once again for joining us. Sergeant Belcher, thank you for your time. Keep up the good work. Let's keep our community safe, and thanks for what you do.
Thank you, Jeff.
All right.